Hello. Hey, everybody. It's Dr. Mitzi here. See if anybody comes on to the live stream. See if anybody logs in. Hope everybody is having a good evening. I'm Dr. Mitzi Williams. I am a board-certified neurologist and MS specialist. I'm going to talk a little bit about MS tonight. We'll see if anybody comes in the room. I'll see if anybody logs in. It's a very busy Monday. Happy Monday. Happy Monday, everybody. Seeing if anybody comes on in the room. Seeing if anybody logs on. Happy Monday. Hope everybody had a great 4th of July weekend, although it doesn't seem like the holiday is quite a holiday when it's on a Wednesday, but that's okay. Still a holiday. See if I invite some people. See if I can invite some people to come in. Let's see. Hello, hello, hello. Is anybody out there? Nobody yet. All right, it is 7. Let's see. It's a little bit after 7. I'll see if anybody joins. If anybody joins me. If anybody. Okay. Nobody so far. But that's okay. It's about 7:06. I'll give a couple more seconds to see if anybody joins me. Okay. Not yet. Okay. All right. Well, I will go ahead and get started, and then I guess I can publish it later, and hopefully people will get a chance to look at this video and learn a little bit more about MS. As I said, my name is Dr. Mitzi Williams. I'm a board-certified neurologist and MS specialist in Atlanta, Georgia, Hotlanta, as I like to call it. And one of my passions is taking care of people who have MS and also educating people about multiple sclerosis. It is a disease that is not as uncommon as people used to think. There probably are over 1 million people in the United States that have MS. And many of those are African American, and so that is a particular research interest of mine. So tonight, I just wanted to talk a little bit about some of the silent symptoms of MS. So the reason that we call them silent symptoms are because it's disability that people can't necessarily see. So sometimes when we think of silent, traditionally we've thought of hypertension as a silent killer. Well, MS can sometimes be a silent disabler. It's very difficult for some of my patients who have some of these silent symptoms to make people understand that they are related to the MS because they look so well. So many people will say, well, Dr. Williams, I really get aggravated when people say, you don't look sick, right? Hello, thank you for logging in. People get really aggravated. Hey, Angie, how are you? Thanks for tuning in. I'm talking a little bit about MS. So people get really aggravated when you say, well, gosh, you don't look sick. I can't believe you have MS. And so some of the silent symptoms are things that can cause a lot of disability and actually put people out of the working force. But they're really under-recognized. So just a couple of things that I'm going to cover in the few minutes that I'm here. I'm going to talk a little bit about fatigue. I'm also going to talk a little bit about cognitive or thinking changes. cognitive changes, and then I'm going to talk a little bit about bladder function. We'll leave the bowel out because people may be having dinner. It might be around dinner time, so we won't talk about the bowel tonight. We'll talk a little bit about the bladder. All right, so let's talk about fatigue. All right, fatigue is one of the most common silent symptoms of MS, and people often have to leave the workforce because of it, and it's a very disabling fatigue. Hi, Angie. Thanks for logging in. Hey, Nicole. Dr. Nicole, thanks for logging in. So fatigue is one of the disabling symptoms of MS. Hey there. And so one of the difficulties is that it is not your general fatigue. So for those of us that have kids, there's a certain kind of tired you feel after you've been working all day and you've got babies. Hey, Auntie Weena. Hey, Auntie Weena. So there's a certain kind of tired you feel after you've been working all day and running around and taking care of kids and all that kind of stuff. That's a certain level of tired. But the fatigue related to MS is like a totally different type of fatigue. So it is just like an exhaustion that people feel. And so it gets worse as the day progresses. So oftentimes people will say, I wake up and I have this amount of energy, and if I use it up by 10 o'clock in the morning, it's done. Sometimes I can stretch it out. Hey, Dr. Tony. Sometimes I can stretch it out for a little bit longer, but that fatigue is completely disabling. And so sometimes there are things that we can do to treat that, but oftentimes, as I said, the fatigue is so disabling that people can actually leave the workforce and stop working because of it. So it really is a huge issue. And the difficulty with fatigue related to MS is that people don't see it. And so often people mistake it as people being lazy, right? So often family members will say, oh, you're just being lazy. You don't want to clean up. You don't want to do the dishes. Now, they may not want to clean up or do the dishes, right? But certainly it is important to recognize that fatigue is a symptom of the disease itself, and is a very disabling fatigue that is beyond your regular tired feeling. And so, hey there, Dr. Diane. Thank you for logging in. Hey, Dr. Tony. So it's very disabling. And so, again, it's one of those invisible symptoms. Sometimes there are medications we can use to treat it. Sometimes the medications don't help very much. And sometimes people actually do have to go on disability because of their fatigue, right? So it's important to kind of recognize that, and recognize that even if someone is walking around and they're not showing signs of disability, like with their walking or with their vision, they can have some of those other symptoms. So fatigue is one of those symptoms. Another very interesting silent symptom of MS is cognitive dysfunction. And so this can happen because people develop lesions in their brain, right? So again, MS is a disease that causes lesions in the brain and the spinal cord, and those nerve signals are interrupted so that the brain and the spinal cord don't often function like they're supposed to. So one of the other common symptoms is that people have trouble with their thinking. Now, some of the symptoms people have with their cognition are sometimes they have difficulty concentrating. They also can have difficulty with attention. So they get easily distracted. So they have a lot of difficulty multitasking, which is really hard for women because women are really huge multitaskers. So it can really affect their ability to multitask and do multiple things at once, and they have to stop and kind of focus on one thing. People can also have trouble with finding words, which can be a big issue for someone if they're a professor and they're used to speaking in front of people. If you have difficulty finding words and you're used to giving presentations, this can be very disabling and interfere with people's ability to work. Now, one of the difficulties with cognitive dysfunction related to MS is that it also can be a symptom of many other things. So other things that can cause the same symptoms with cognitive dysfunction are fatigue, right? If somebody's really tired, right? Think about if you're up all night, so I have a 15-month-old, and so sometimes when baby Sarah decides she wants to wake up in the middle of the night and fuss or what have you, and I get up the next morning to work, I can't really think straight, right? Or if you have a rough night or for some reason you can't sleep or have insomnia, you can't really think well. And so fatigue is a symptom that can cause some of the same issues as we see with MS. And also sometimes medications that we give, right? If you're taking certain medications that make you sleepy or kind of slow you down, that can cause similar symptoms as the cognitive dysfunction we see with MS. And then another very important issue that can cause similar symptoms is depression. This month is Minority Mental Health Awareness Month, and so a lot of people are talking about different issues with depression and anxiety, which can be under-recognized or under-treated in some populations. And so depression is is a disease state or a problem that can cause the same symptoms as we see with cognitive dysfunction from MS. So generally what I say is we have this much from the MS, right? And then if we have a lot of fatigue, right, we add that on top of it. It makes the thinking this bad. And then if we add, let's say, medications or depression or stress on top of that, it's this big of a problem that interferes with somebody's ability to function and work and live their everyday lives, but maybe only this amount is from the MS, okay? So it's very important to recognize when that's going on, to not be afraid to ask for help, and then to tell your doctor what's going on so that they can try to figure out what part is related to the MS and what part may be related to other things. I think it's also important because, as I said, those symptoms like fatigue and depression can affect a person's thinking and affect their memory. And sometimes people will go to the doctor and say, hey, I'm having a lot of memory trouble, and it could be more related to those things versus some other type of disease. And then the last silent symptom that I want to talk about tonight is bladder problems, right? So not your favorite dinner topic. I said I was going to skip the bowel because people may be eating dinner tonight. But bladder symptoms are a huge issue with multiple sclerosis. And so I put them in two categories, right? So I say bladder symptoms with MS are either gotta go, or gotta go and can't go, right? And sometimes people have a combination of both of those things. And so again, one of the important things with MS is that people can have these symptoms from other diseases or other problems, which is sometimes why it's difficult to diagnose MS and difficult to treat, because sometimes there are other things that can cause the same symptoms. For instance, if a woman has had a baby, right, sometimes that bladder is not working like it used to work, before you had kids. And so sometimes we have to try to figure out, is the bladder problem related to other issues or is it related to the MS? And basically they're treated different ways. And so oftentimes as a neurologist, we can treat the bladder symptoms related to MS. However, if we get in what I call uncharted territory, then sometimes I will refer a person to a urologist. And so that's why it's important for people living with MS to have a team, right? So the team is not just the neurologist, but there are often lots of other people involved. Hey, Janelle, thank you for logging in. So lots of times there are other people involved in caring for people with MS because there are often a multitude of symptoms that need to be addressed. So again, some of those silent symptoms, those things that can silently disable someone and cause people to look at a person and say, well, gosh, you have MS? Hey, Dr. Shardetta, hey, Dr. Cece. Some of those silent symptoms that may cause someone to look at someone and say, hey, but you don't look sick. It's important to recognize that some of those symptoms, there are a lot of symptoms, that we can't see that can cause a lot of disability. So there's fatigue, again, as we discussed, very disabling fatigue can take people out of the workforce. There is also cognitive dysfunction or problem with thinking that can affect people's ability to work and to function on a regular basis. And then also their bladder issues. Important things to do are to make sure that people are following up with their physicians, because as I said, there are a lot of other things that can be playing into the cause of those symptoms. So we have to make sure we're figuring out what's related to the MS and what may be related to other problems or other issues that someone has. So again, it takes a village. I always say it takes a village to take care of my kids, which I have a wonderful village, but it also takes a village to take care of people living with MS. And just remember to reach out to that person who looks like they don't have disability because they're walking fine, and recognize that they very well may have a lot of disability that you can't see. And so it's important to remain educated about that and make sure people's families and friends understand that they're not ignoring you, that they're not just tired and lazy and don't want to go out, but sometimes it is actually the disease affecting them. So anyway, with that being said, thank you guys so much for spending a little bit of time talking about something that's very important to me. I hope that it was helpful and that you learned something. And if anybody has a few questions, I can stick around and answer a couple of questions. And we'll see if anybody has a question. I don't know. See if anybody has any questions. Thank you guys so much for tuning in. I certainly appreciate it. I know that Monday nights are busy, so I appreciate everybody logging in and see what we got going on. Hey, Dr. Anna, how are you? Thank you for logging in. Talking a little bit about MS. talking about some of those silent symptoms of MS, and just making sure we check on our friends and family members who may look like they're doing okay and look like they're walking okay, but recognizing that there's a lot of disability that we can't see. So, does anybody have any questions? We talked about fatigue, we talked about cognitive dysfunction, and we talked a little bit about bladder dysfunction. We skipped the bowel because it's dinner time, so we'll talk about the bowel another day, maybe in the afternoon. Okay. All right. Well, thank you guys so much for logging in and listening. Thanks, Dr. Charnetta. I hope everybody has a wonderful evening. And I'm going to go put the kiddos to bed and then hopefully get a little sleep myself. All right. Well, have a wonderful evening, everybody. Thank you so much. Good night.